There is a part of your body you look at every single day without really seeing it. You brush past it every morning in the bathroom mirror. You use it constantly to speak, to taste, to swallow. And yet almost no one over the age of 60 has ever been told what it can reveal about what's happening deep inside their body. Your tongue, not the obvious things, not a sore that won't heal, which, yes, you should always get checked. But the subtle changes, the coating that shows up overnight, the cracks that deepen over time, the color that shifts so gradually you stop noticing it. A woman in her late 60s mentioned almost in passing to her doctor that her tongue had felt strange for months, thick, almost coated, and her sense of taste had quietly faded. Her doctor nearly dismissed it. But a thorough follow-up revealed her digestive system had been under serious stress, and her gut bacteria were severely out of balance in a way that was affecting her nutrient absorption. She had no stomach pain, no obvious symptoms, just her tongue quietly sending the signal. Today, we are going to walk through 7 specific changes you can see on your tongue, right now if you wanted to look in a mirror, that your body uses to flag problems in your liver, your kidneys, your gut, your immune system, and your cardiovascular health. We will describe exactly what each one looks like, what it traditionally indicates, why it almost always gets overlooked, and what you should do next. Your body is talking. This is one of the clearest channels it uses. Signal 1. A thick white or yellow-white coating across the surface. If you look at your tongue and instead of seeing a healthy pinkish surface, you see a layer that looks almost like a film, white or white with a yellowish tint, covering most of the middle and back of the tongue. That coating deserves your attention. A thin white coating on the very back of the tongue in the morning, before you have eaten or drunk anything, is fairly normal. That is just overnight bacteria buildup, and it clears with brushing and hydration. But a thick coating that persists throughout the day, that doesn't brush away cleanly, or that has a distinctly yellow or yellow-white color, that is a different signal entirely. In traditional medicine and in modern gastroenterology, a persistent, thick white coating is most commonly associated with an overgrowth of Candida, a yeast that lives naturally in your digestive tract but can multiply out of control when your immune system is suppressed, when you have taken antibiotics recently, when your blood sugar runs consistently high, or when your gut bacteria are out of balance. The yellow tint shifts the meaning slightly. A yellow coating on the tongue, especially if it appears toward the back and middle, has long been associated in both Eastern and Western medicine with liver or gallbladder stress. When your liver is working harder than it should, or when bile flow is sluggish, that yellow tinge often shows up on the tongue before you feel anything else. Why does this get missed? Because people assume a coated tongue means they didn't brush well enough. They brush harder, it improves slightly, and they stop thinking about it. But if the coating returns day after day regardless of your oral hygiene, something systemic is driving it. Signal 2. Deep cracks or fissures, running along the surface. Some people are born with what is called a fissured tongue, naturally grooved or cracked, and for those individuals this is simply anatomy, not a warning. But if your tongue has developed cracks that were not always there, or if existing cracks have deepened noticeably in recent years, that change is worth understanding. A fissured tongue that develops or worsens over time has been associated with several conditions. Nutritional deficiencies are among the most common, particularly deficiencies in B vitamins, especially B2, B3, and B12, as well as iron and zinc. These are the exact nutrients that older adults tend to absorb less efficiently as stomach acid production naturally declines with age. Sjogren's syndrome, a condition where the immune system attacks moisture-producing glands, also frequently presents with a cracked, dry tongue, often alongside dry eyes and dry mouth. Many seniors have this condition without ever receiving the diagnosis. Psoriasis, which most people think of as only a skin condition, can actually affect the tongue as well, producing distinctive cracks and patches. And in some cases, deep tongue fissuring has been associated with chronic inflammatory conditions that are quietly active in the body. If your tongue has fissures, pay attention to whether they are also accompanied by dryness, a persistent sore or inflamed feeling, or difficulty tasting. The combination of signals matters. Signal 3. A bright red or strawberry red tongue. A healthy tongue is a soft, muted pink. Not bright, not vivid. If your tongue has developed a noticeably red or intense crimson color, especially if it also looks smooth and almost glossy, as if the tiny taste buds on the surface have flattened or disappeared, that is a signal your body is sending about nutrient deficiency at a significant level. A smooth, bright red tongue is one of the classic presentations of B12 deficiency, which is extraordinarily common in adults over 60, particularly those on metformin for blood sugar management, those who have had stomach surgery, or those whose stomach acid production has declined. B12 deficiency at serious levels affects your nervous system, your cognition, your energy, and your cardiovascular health. And the tongue often shows it before blood work is ordered. Iron deficiency anemia can produce a similar appearance, a tongue that is red, smooth, and sore, often accompanied by a burning sensation. Kawasaki disease is a condition more commonly discussed in children, but certain inflammatory responses in older adults can produce a similarly reddened tongue surface during acute phases. If your tongue has become noticeably redder than it used to be, and especially if it has that smooth, almost glassy texture rather than the normal slightly rough surface, request a comprehensive blood panel that includes B12, folate, and iron studies. Signal 4. Purple or bluish tones, especially under the tongue. Lift your tongue and look at the underside. You will see two veins running along the bottom. They are normally a soft blue-purple color. But if those veins appear very dark, very prominent, or if the underside of your tongue itself looks dusky or purplish rather than pinkish, this is a signal about your circulation. A purple or blue tint to the tongue, particularly underneath, has traditionally been associated with poor oxygenation of the blood and sluggish circulation. When your cardiovascular system is not moving blood efficiently, whether due to early heart failure, lung function decline, or poor peripheral circulation, the tongue can begin to show cyanotic signs before you experience obvious shortness of breath or fatigue. In Chinese medicine, which has observed tongue diagnosis for centuries and which increasingly overlaps with observations in functional medicine, a purple tongue is specifically associated with blood stasis, meaning the blood is not circulating freely. This has correlations in Western medicine to cardiovascular congestion and clotting tendency. If you have noticed your tongue or the underside of your tongue looking darker or more purple than usual, particularly if you also feel occasional chest heaviness, unexplained fatigue, or swollen ankles, do not wait to mention this to your doctor. Signal 5. White patches that don't wipe away. This one requires particular attention. If you notice white patches on your tongue, not a general coating, but specific defined patches that have sharp or irregular edges and that do not wipe or brush away, these need professional evaluation without delay. These patches are called leukoplakia, and while they are not always dangerous, they are considered a precancerous condition in a meaningful percentage of cases. They develop most commonly in people over 60, in people who smoke or have smoked, and in people who drink alcohol regularly. Leukoplakia patches are flat or slightly raised, white or grayish-white, and they feel slightly thicker than the surrounding tissue. They do not hurt, which is precisely why they get ignored. There is also a related condition called oral lichen planus, which produces white lacy or web-like patterns on the inner cheeks and tongue. This is an immune-mediated condition that requires management. Neither of these is a diagnosis you can make yourself, but the signal is simple. Any white patch that has been present for more than 2 weeks and does not clear with improved hydration and oral hygiene needs to be looked at. This is one of the tongue signals where early attention genuinely changes outcomes. Signal 6. A pale or almost colorless tongue. Where a red tongue often signals deficiency in specific nutrients, a pale tongue, one that has lost much of its normal pink color and looks almost whitish or very light, signals something broader, that your body may not be producing or circulating enough healthy red blood cells. Severe anemia, whatever its cause, frequently shows in the tongue. The mucous membranes of the mouth and the tongue itself depend on good blood supply for their normal color. When that supply is diminished, they fade. In seniors, unexplained fatigue and paleness that is dismissed as simply getting older may in fact be iron deficiency anemia, B12 or folate deficiency anemia, or in some cases, anemia associated with chronic kidney disease or with other systemic conditions. Look at your tongue in good natural light. Compare it to how it looked even a few years ago in photographs. A tongue that has noticeably paled over time is one worth discussing explicitly at your next visit, not as a passing comment, but as a specific concern you raise and ask to have investigated. Signal 7. A swollen tongue with scalloped edges. Look at the sides of your tongue, the edges. Do you see indentations along the sides that look like the scalloped edge of a pie crust? Those marks are made by your teeth pressing into a tongue that is slightly too large for the space it normally occupies. A scalloped tongue, as it is called, is most commonly associated with hypothyroidism, an underactive thyroid. The thyroid, when it is not producing sufficient hormone, causes fluid retention in tissues throughout the body, including the tongue. The tongue swells subtly, presses against the teeth, and leaves those characteristic indentations. Hypothyroidism is one of the most commonly underdiagnosed conditions in adults over 60, particularly in women. Fatigue, weight gain, feeling cold, brain fog, constipation, and dry skin are its classic symptoms, but they are also very easy to attribute to aging. A scalloped tongue is a physical visible sign that something specific may be suppressing thyroid function. A scalloped tongue can also appear with sleep apnea, with B12 deficiency, and with certain digestive conditions. But in a senior who has not had thyroid levels checked recently, this particular tongue shape is a compelling reason to request that test. Your tongue is not random. Every color, every texture, every shape it presents is information. Information your body has been carefully assembling from what is happening in your liver, your gut, your blood, your thyroid, your immune system, and your circulation. None of what we covered today is a diagnosis, but each of these signals is a language, a specific thing your body is trying to communicate before something becomes harder to treat. Take 60 seconds today. Find good light. Stick out your tongue. Look at it the way a physician would, with curiosity, not fear. And if something you see matches what we discussed, write it down, take a photo, and bring it to your next appointment. Not as an aside, as a specific concern you name and ask to have addressed. Your doctor has 7 minutes with you. You have the rest of your time with yourself. Use it. In our next video, we are going to look at something even smaller, the tiny white half-moons at the base of your fingernails and what it means when they start to disappear. You might want to check your hands before we get there.